Welcome to Livewire Markets. If there is one area of the global equity market that gets an impact investor's tongue wagging, chances are it's healthcare. All sorts of companies, from the emerging biotechs to the very largest medicine manufacturers, are actively in the business of making life better and longer for us all. And we're going to tackle some of those themes today in this episode of The Pitch. I'm Hunsley of Livewire Markets, as I say, and joining me today, Hari Balkrishna of T. Rowe Price. Hari, welcome to you.
Thank you.
So, healthcare is one of your largest holdings by sector in your fund, the Global Impact Equity Fund. Why is healthcare, as a thematic, so crucial to an impact fund like yours?
It's crucial for a couple of reasons, right? So first is a third of the world doesn't have access to essential medicines. So it's absolutely critical that, companies reduce the cost of healthcare access when we think about, medicines around the world. And secondly, when you look at, even in countries where there's access to medicine, we have a lot of issues, right? In the sense of when you think about, dementia, when you think about cancer, when you think about obesity-related diseases, a lot needs to be solved for. And so it's really important from an impact fund's perspective that, if we're trying to solve for the sustainable development goals, of which good health and well-being is one of the goals, healthcare stocks can play a very important role. But I think it's important to qualify, not every healthcare stock is an impact stock. In our opinion, it's companies that enable healthcare innovation or bring down the cost of healthcare access or genuinely have groundbreaking healthcare innovation to solve for one of those large unmet needs.
Yeah, no, absolutely. You mentioned obesity-related diseases, and that is a good segue onto a question about a particular focus that I know you have this year, which is the GLP-1 space. I mean, hasn't that theme exploded everybody, just with Eli Lilly and Novo Nordisk and companies doing these clinical trials now? Why do you think this part of the healthcare sector is worth spending so much time and resources on?
So the reason why I think it's worth spending so much time on is, we have firstly an obesity epidemic, right, in a lot of developed markets and increasingly in some emerging markets, right? And so if you think about, for all the press that's out there about the cosmetic, sort of aspects of these weight loss drugs, in our view, more than 95% of the use case is basically to address that obesity-related disease issue in the world. And when you think about not just the improvement in the quality of life for the individuals associated, taking with these drugs, it's also the reduction in the cost of the healthcare system. So think about if you have fewer heart attacks, you have fewer sleep apnea issues, fewer knee replacements or hip replacements because of weight-related issues, it just brings down the cost to the whole healthcare system. So that's where we think these GLP-1 drugs can play a very important role. Having said that, they're not yet at a cost point that we're happy with. We think over time the costs will come down and access will improve to people who genuinely need it.
Yeah, no, absolutely. So I'm curious then, what is one company you are invested in with this theme in mind? I'm curious whether it's even Eli Lilly or Novo Nordisk.
So actually, we do own Eli Lilly, but the one I'd like to talk about is Chugai Pharmaceuticals. So this is a company listed in Japan. And the reason we're so excited about it is it's going to be the key enabler of bringing the cost of the GLP-1 drugs down. And the reason for that is it owns or has basically created the molecule that enables the oral solution to GLP-1. So it's called orforglipron. So it's basically the next stage trials that are going to come out in the spring of 2025. And we feel very positive and excited about the potential for the oral version of these drugs, which should bring the cost of these drugs down and improve access.
You've also got a big exposure to the life sciences and biotechnology space, which is, as I understand it at least, it's a space that requires intense specialization, in a lot of cases very deep knowledge. So I'm curious, what is your edge in that space, and why do you think you can deliver outperformance in this part of the healthcare market?
So firstly, we're blessed in the sense that we have a dedicated healthcare fund in T. Rowe with a lot of analysts, with a lot of expertise in the biotech and healthcare space. So that's, we're getting a lot of inputs that allow us to sort of make those decisions. But most of what we own in the Global Impact Equity Fund are actually life science tools companies. So companies like Danaher, Thermo Fisher. So they basically enable biotech and biopharma companies to innovate better. So in some ways, it's a little bit like owning the picks and shovels in biotech. And so as long as there is biotech innovation, as long as there is biopharma innovation, and we see the cadence of clinical trials going up, we see the cadence of drug approvals going up, these companies benefit. And obviously by enabling that innovation, so if you take a company like Danaher, for example, they have a huge role to play in the manufacture of cancer drugs, right? And so there's huge impact there, but also as there's more innovation happening in cancer drugs, they benefit as they go with it. And you can make that bet without actually owning a single biotech stock, which, as you say, comes with a fair bit of risk.
Perfectly summed up, sir. Thank you very much. That's Hari
Thank you.
Balkrishna of T. Rowe Price. And thank you for joining us. If you enjoyed that episode of The Pitch, you can subscribe to the Livewire Market Index websites, as well as our YouTube channel. Thank you for watching.